So what do we have to look forward to in the immediate future, the next 1, 2, 3 years in antiemetics? To take 70 to 80% of patients treated according to guidelines to close to the total elimination. We already can personalize care because we understand who is at highest risk. Younger women are at the very highest risk, and we know other risk factors such as teetotalers are at higher risk. And so we can identify who are at the higher risk, and those are the patients in whom we should be doing the studies. So one question that I have we reached the optimal dose of using the NK1 receptor antagonists? There's several that are investigational. We have aprepitant and fosaprepitant on the market, the IV aprepitant equivalent, and then we have rolapitant and nitupitant that are being studied. So do we know the optimal dose or just good doses of these drugs? Would raising the dose give better distribution in the brain and give better control? I think there are some interesting phase 2 studies that make this a provocative question. So if we looked at the highest risk groups and gave them a higher dose, getting up to some element of maximally or not close to maximally tolerated dose, but a dose that comes closer that shows some degree of side effects since we don't have one, I think this is one approach. Another approach is looking at different receptors that we currently don't block. So there is research with drugs like gabapentin that looks at apparently GABA receptors, and then a drug like olanzapine that looks at a whole variety of different receptors. In patients who have not had good control or who are at very high risk, if we add these agents, do we improve the control of emesis? Do we improve the control of nausea? So I think in the immediate future of the next 1, 2, 3 years, those are the approaches that will be used. As far as following guidelines are concerned, well, you know, that becomes very interesting. Will this become part of a quality improvement project? Will guideline consistent, high quality guideline consistent antiemetic guidelines be regularly part of electronic order entry, making it almost difficult not to follow guidelines? I hope so, but that's another way where we can get effectiveness, what happens in the real world, to equal efficacy, what happens in the studies.